Well, hi, this is Andrea Alamani with Patient Navigation Team, and today our Give 'em Health podcast is going to be about your insurance, your medical insurance. And so we are going to get some clarity on that today with Tracey Williamson. She is with US Health Advisors. And so we're happy to have you. Thank you for being here.
Thank you for having me.
This is just such a confusing topic for everyone. And we were talking about transparency. And I guess the first thing I wanted to ask you is why are you a health advisor?
So you mentioned so many of us are not clear or fully understand our health insurance. That was me, which is why I jumped into doing this because many years ago when I had my first child, I was a teacher. So you think great insurance, state health plan, and I will say that at the time it was good coverage because I didn't really pay a whole lot for it, but I had no clue what it did. I had no agent to help me understand it. Our HR department will direct you to the 1-800 number.
Okay. And
so, long story short, when I had my son at the hospital, I was dealing with paying off one bill and then given another that amounted to $4,000. I had no clue I was going to have to pay.
Wow.
So I wanted to be someone to be there for people like myself, to just help them walk through, this is what your plan will do, this is what it will cover, this is what your bill should look like. So you don't, deer in headlights when you're sitting there.
Exactly. Well, I just broke my toe last year and I had like 3 bills come in and I didn't know what they were for. They were for 3 different areas and I was like, oh, it's just a broken toe. I mean, it can't be that difficult, but it turned into that. So tell me a little bit about what you're able to do for your clients when you sit down with someone. What does that look like for them?
So kind of the same as what we're doing right now. I'd like to do a consultation with someone because health insurance is very personal. It's personal to who you are right now, but it's also personal to who you will be several years from now. And then why do you have the plan that you have? I ask people things like, what do you love about your plan? What do you not love? Do you know most people know what their copays are. Like, that's the number one thing people say, well, what's my copay? I'm like, your copay is really the least of your concerns because in the example of a broken toe,
right,
you've got to look at then what your deductible look like. Does your deductible have anything outside of it that you get benefits for before meeting it, which most plans do not. So depending on how high it is, will then ultimately decide on what your bills look like. And then outside of that is your max out of pocket and that kind of stuff. So I always ask people the pertinent information about their plans so that way they understand not only are you paying your premiums, then you've got to meet your deductible, and then you kind of get some co-insurance before you meet your max out of pocket. And after those 4 steps helps me know what kind of plans can we then look at outside of that.
Okay.
Someone's health, of course, and all those things. So there's a lot of questions and things I go through to get to know my clients and to help them understand their plan before we look at other stuff.
Okay. Well, one of the things I tell people is never go into the doctor asking for some medication they've seen advertised on TV, right? Because those are always patented drugs, and that's going to cost you more money, if not initially, certainly down the road after the coupon is expired and you're going in to get it filled, right? So do you see that generics help people save money with their insurance as well?
Generics are going to save people money, period, anytime that they decide to go with a generic. I had a client last year, actually, her husband's diabetic. And so when we were chatting, I'm like, well, there's lots of options for insulin and diabetic medications. Metformin is so popular. Most people don't know Publix has a free publication of medications that they just hand out. Metformin's one of them. Lisinopril for high blood pressure is another that they literally just hand out for free.
Okay. And I did not know that.
Right. So that's another thing that anytime you can go with a generic, you're going to pay less because it's no longer that, close kept secret.
Right.
So.
Right. Well, I remember for me, I was on a medication that was patented and I wasn't able to get a better deal on my health insurance. So I probably need to check that out again because one of that med has gone generic. So I could save myself some money, right?
Definitely.
If I'm using the generic, but I could probably change my insurance policy. Is that
definitely.
Something okay.
So I always ask people, what kind of prescriptions they take, what they're for, so that way we can look at, because again, once you venture into other realms of health insurance, I always break it down into 2 branches. So health insurance, you've got your ACA plans or employer plans, which all meet those standards, and then you have health-based plans.
Okay.
So all of these health-based plans cover different amounts for medications. Different ones have different caps on medications and things like that. So
I see.
That's where, when I met with this diabetic client, he has to take a particular type of insulin.
We were talking before we started recording about transparency in terms of cost, and you had mentioned GoodRx, which is something I go to as well for reference. So how do you use that for yourself and for your clients?
So GoodRx is fantastic as far as
I agree.
Price comparing. One, your pharmacies, and then two, the actual cost of the medication. Most people don't know what different medications cost. So for me, I have 2 young kids, 3 and 5. So it's so funny because I always ask people, are they taking the pink stuff? Because everybody's kids gets prescribed amoxicillin for everything.
That's right.
Another one of those free medications at Publix that I have also learned about. But on GoodRx, you can get it for a couple bucks. Well, if your copay is $10, you're really paying 100% of that cost. So GoodRx is fantastic, just to have knowledge of what does my prescription actually cost. Or if you're sitting at the doctor's office and they start suggesting things, they'll hand you those free samples of something, but it'll also allow you to check, well, what does this medication actually cost? Wait a minute. And then GoodRx will suggest if there is a generic for it. So that way, when you actually get your prescription,
you can find that out, right?
And
they also, on the app, they also give the drug information in there too. So it lists everything in terms of the purpose of the medication, the scientific classification, all the stuff that I love to read. But it's all there. So it really is a good reference. So I'm glad to hear that you educate your clients about that too. So.
Definitely. Well, and then interestingly enough, I had a client that I met with many, many months ago. She has anxiety, which is very common nowadays. And especially amongst us women, I have no idea why.
I can't imagine.
I can't imagine. Mom and wife, and anyways. So she was taking a particular medication. Well, when we looked it up, it also takes care of a major heart condition. And so I asked her about it. I'm like, were there any other options as far as medications for you? Because, again, a good conversation to have with your doctor, and I'm sure you help your clients with this, is sometimes prescriptions will handle a lot of different conditions. I'm not a doctor, but I can only imagine what that does on your kidneys after a while. So again, I always encourage people, know the medications you're taking before you take them. So
definitely.
Yeah.
Or ask the questions of your doctor.
The more we know, the more we know.
And the pharmacist is really a great resource as well, because they know all of your medications, so they can help you. And they don't have any sort of restraint on them in terms of communicating prices, where you can save money by talking to your pharmacist and asking them about the prices as well.
Right.
So they can do that now. I was going to ask you next, what do you wish all of your clients knew about health insurance? Is there something global that would be beneficial for me or for my parents or anyone that comes to you to know or to ask?
Wow, that's a lot of things.
Okay. Just maybe 2 or 3. That's fine.
So, health insurance in general. Make sure that you're working with an agent that you know, like, and trust. I can't tell you how many people I talk to, and I do some sales over the phone, right? Because we have a global network nowadays, right?
Okay, yes.
And people do shop online for things. I have lots of clients I've never met in person, but they like me because they know when they call, they can reach me, whether it's a good thing or a not good thing. I will always take care of my clients. So I've helped a lot of people because they get an agent that just fast talks them, sells them a something, and then a week later they can't reach this person ever again. So that's something, really know the person that you're working with.
Okay.
And also, what I always encourage people to know or ask is, what does my plan not cover? Because we're going to always talk about the great things, right? And people buy on that,
That's very good point.
But you always want to know what a plan does not cover. I always go over the ins and outs of our plans because there are certain things that plans don't cover.
What's an example of that? Like reconstruction after a mastectomy or those kinds of things?
Most plans do not cover any kind of reconstructive surgery or anything that's deemed cosmetic. Again, that's usually an elected surgery.
Okay.
again, when you venture out into health-based plans, they have different contingencies for mental health, substance abuse, immunizations.
Okay.
One plan in particular that I've looked at will give you a stipend for your physical exam of $125, right?
Oh, okay.
And that's for all of it. Our plans at US Health, for example, we cover your physical exam, mammogram, pap smear, all the different little pieces of it, and we have different benefits towards each piece.
Okay.
Immunizations is another thing. So some plans will cover children's immunizations, but not adult immunizations, like your flu shot and those kind of things.
Okay.
So all of those factors will determine to your premiums, right? So the more benefits you have, typically the higher your premiums are going to be. So there are a lot of options, and people that have a workplace plan or an employer plan, you just go with it because it's what's put in front of you. I've helped so many people that have an employer provided plan that they are astronomically expensive. So I had, she was a mortgage broker, her husband, and she had a 9-month-old daughter. She's like, Tracey, we're healthy. We exercise a lot, we eat right, and I'm like, well, clearly, because you're beautiful. And they were paying over $900 a month for their health plan for the three of them. I could not imagine. Having been a teacher, I'm like, that's over half my paycheck. Like, oh my gosh. So, I just took her through the gamut of, there are so many other options to choose from. So like when you had mentioned yours, again, the next thing people complain about.
I think I need to sit down with you.
When people are frustrated with what they pay, it's because you're healthy and you're like, I'm not getting $500, $600, $700 a month of benefits.
Yes.
To validate, paying that.
Right.
So that's another joy of what I do, is just helping people find relief of that financial burden and then being able to use that money on something else. Future retirement, those kind of things. So I think going to a specialist, like in that sense of, I only do health insurance. Like, this is my world. So everything I know insurance-wise pertains to health insurance, versus when you go to a general agency who does auto and home and life and disability and this.
Oh.
Yeah, you're getting someone who knows a tad about everything, but not necessarily everything about that one subject.
That's great.
Yeah.
I mean, that's great advice, because sometimes I think we feel like if we just get any answer, it's good enough, and you don't want to deal with it. It's kind of like having a will done or something like that. You want it to be handled and done, and you don't want to revisit it. But the truth is, revisiting it, from what I'm hearing you say, can save you money and get you on the right plan, and you really can know what you have.
Right.
And I love your point about asking, what does this not cover? I don't think I've ever heard anybody suggest that, and that's such a great thing to ask. So.
Right, and that's the area that people get frustrated with, right? When you go to use your insurance plan, whether it's your car, home, health, anything, that's where people get upset when they go to use it, and then you find out all of a sudden, wait a minute, that's not covered. I just heard a story the other day from a property casualty agent who client was doing yard work, and they poked I can't remember if it was a water sewer line or something. Water line, anyways, a drainage line, there we go. And the walls of their basement caved in.
Oh my gosh.
And so an insurance adjuster comes out and checks the home, yada yada. Well, it was deemed the homeowner's fault because they poked the drainage line, so the water wasn't able to drain the way it was supposed to, which caused the walls to cave in. And so the insurance company covered part of it, but not everything. So I could only imagine how hefty that bill was and how upset that homeowner was. And it's like, oh my goodness. But those are things that sometimes you don't think to ask. Like, what am I still liable for? You just think, oh, it covers everything. No.
I know. No. It seems like in a lot of these realms with insurance, you don't really find out what you've got until you're having to use that policy for whatever your situation you're in. Yep. So I love that question. What does it not cover? Yep. So any other questions that people should ask when they're looking at health insurance?
I've had clients ask me some very, prudent questions, which I love, because I love that challenge of answering that for someone. Last year around this time, I had a client, they had Blue Cross Blue Shield, and, reached out to him like, hey, they went online and requested a quote and that kind of thing. And I was like, hey, this is what I would be able to do for you. And provide all these benefits, yada, yada. Ultimately, they were like, Tracey, why should we go with you? I was like, well, because you get me. and two, I'm like, because you're upping your benefits and saving money. I'm like, if you had switched to me, imagine 10 years ago, we would have already paid for your daughter's college education twice. Twice they would have paid for it.
Wow.
So, and that's the other thing is I'm like, you never want to sacrifice benefits, right? Because you want to make sure you have the coverage you need and want at the time when you go to use it. But also you don't want to end up paying so much for benefits you never use.
But you can be overinsured, right? I mean, I think, and I was just looking at my homeowner's policy the other day, and I'm like, I have, I think, way too much liability insurance. It's just been sitting there, and I haven't revisited it. And so I think sometimes we have too much. And so finding that right sweet spot is really something it's definitely a bit of a shell game.
Yep. That's another reason U.S. health advisors really appeal to me, because I am probably the most anti-insurance person, or have been, because I always felt like I was paying for things I have a perfect driving record. Right? You know, I don't want to pay $800 a month for my car insurance. That's what I pay.
But you know, the day you don't have insurance, you're gonna you're gonna hit one car with the other car, right?
That 10-car pileup. Yep, exactly.
I know that.
And that's what I like about our plans at U.S. Health is that we have the only insurance policy that you can actually upgrade your coverage after a claim. So you can really customize your health care to who you are at this time, and then obviously who you are at 30 years old is not who you're going to be at 40 years old, and who you are at 40 is not going to be who you are at 50. So I like that our plans are very flexible, and they made sense to me. I was like, wait, that's like paying for a car accident after you had it. And they're like, yes. And I'm like, that's really cool. So that was another reason that I was like, okay, this makes sense for me, because I think that's really neat.
So you have multiple, so you sit down with someone and you kind of vet all of the different variables they have, and then you have multiple policies that they can shop from?
Yes.
Is it with multiple insurance companies, or is it through just one? How does that part work?
So when we look at different policies, what's interesting is how much information is available online. All the major carriers use like eSurance and eHealth to really print and public all their different policies that are provided through independent carriers. So I can walk people through all of those. Typically they're going to be short-term plans. The plans I sell are through U.S. Health Group, but I'm licensed here and in 11 other states. So I can review all those plans for people, tell them the ins and outs, and again, depending on someone's current situation, help them make that decision that makes them feel really good about the choices that they're making. So
well, thank you.
Yeah.
I can see where working with you would be so much easier than trying to figure it out by yourself. And I think you would walk away feeling like you've made the right decisions. So one of the questions that I've had people ask me, and I have no idea how to answer this, is it better to pay as a cash payer at the doctor's office when you're checking out? Is it better to pay as if you don't have insurance and then file that claim yourself, or is it better to pay with your policy immediately there and then pay the copay?
Again, it just totally depends on what your policy is and how it's set up. So yes and no. The interesting thing is you can cash pay at the doctor's office and come out with a lower cost than using your insurance a lot of times. Doctor's offices will immediately negotiate a cash pay price. In the sense of just a normal everyday doctor visit, that's great. When you're talking about a quadruple bypass or dealing with chemotherapy, it's really hard to cash pay at the doctor's office for those things.
Right.
Will they set up payments? Maybe. And then again, you run into the whole, when you go to the people at the desk that set the appointments and take your insurance cards, they really have no clue what anything costs, so they can't necessarily tell you that. It all has to go through billing. It really just depends on what your plan is.
Okay.
So
that's an interesting question too, because it also kind of goes into another thing that I've seen is that people will get a bill from the doctor and it'll have the cost, and then it will have some sort of write-off for that cost, and then it goes on to say what you're supposed to pay and what your insurance has paid, and then what you then owe. What is that? write-off part? What is
That's the network rate. So like if you have Blue Cross Blue Shield, you'll still see their network rate. United Health, they have their network rates. Cigna, they all have their network rates. If you go with a private health plan, they use what's called the PHCS, the Private Healthcare System Network. That is their negotiated network rate with the doctor. So when I explain like a PPO network versus an HMO network, I always tell people it has to do with how many friends your doctor or the insurance company has with all the different doctor's offices.
Okay.
And they cut different rates to different insurance companies based on those networks, right? That's another good thing about starting in 2020. Hospitals, doctors' offices are going to have to start disclosing their pricing with consumers so that way we can make educated decisions. So, for example, my senior agent had a surgery done, and he checked with all the different hospitals around to see what's the best rate. What do you charge? And it was interesting. He checked with a hospital facility in Alamance County, and it was like a $60,000 surgery there. And then checked here in Greensboro, and all of a sudden it was a $30,000 surgery. Why is there a difference of $30,000 for the same exact surgery? Now, granted, doctors and facilities and I'm sure all that makes a big difference, but it's just amazing. Why can't we go online and search for these things?
Well, I think that's a whole nother podcast,
Oh,
right?
yeah.
Because then you're talking about, well, how beneficial is it for you if they're giving a cost for an MRI, and then you all of a sudden need more scanning done than that particular cost that they've identified, then what happens? And so how does that get covered? So it's a tool, but we have to be careful with that tool as well.
Yep.
I know that you run your business over in Winston, actually on the other side from Greensboro, but you just said you're registered to practice in 11 states.
Yes.
So that means there's pretty much no limitation for you in terms of who you can help within those 11 states. So,
Right.
So we're going to ask you how we can get in touch with you.
Anyone can call me anytime. I'm fine with that. Having been a teacher, I kid you not, I had a parent call me at 10 o'clock one night, like, where is my daughter? And I'm like, oh my gosh. Yeah, it was an interesting situation. 5th grade graduation, I'll leave it at that. 336-692-6681 is my cell. Call or text me. I'm here to answer any questions health care wise that I can. And if I can't personally answer, then I will find someone who can. Other than that, my website, my cell phones list their email, as well as you can just click quote and it'll instantly email me like, hey, get in touch with this person. And that's www.ushagent.com/Tracey Williamson.
Wow,
it's
okay.
EY. But yeah, I would love to help anyone that is just frustrated with their coverage costs or just want to know, hey, this is the best plan that I could possibly get, that's out there. So
thank you.
Yeah.
That's great. That's great. So I hope we've broken down or busted another barrier for our Give 'em Health viewers today. I'm Andrea Alamani with Patient Navigation Team, and our website is www.patientnav.com. Thank you so much.